This is a series of short videos for patients who are considering bariatric surgery. Although bariatric surgery can be seen in isolation as an operation on the stomach, it has a range of systemic effects. Systemic means the treatment can potentially affect many organs in the body, and that includes the mouth. How oral health might be affected is something we still don't know much about, both among those of us who work with bariatric surgery, among dental professionals, and not least among patients themselves. Dental care is fundamentally different from most other care you receive in specialist services in Norway. And the clear sign? Well, you generally pay out of pocket for dental treatment. That kind of premise for getting care means some people fall through the cracks, they seek dental care too late, and end up with more extensive treatment needs. If we focus specifically on patients having bariatric surgery, we also know that many have poor oral health already before surgery. Quite a few have a complex health situation in general, many are on a tight budget, and dental anxiety becomes more common as BMI increases. That, in short, is the starting point for many who undergo bariatric surgery. And then there's the question of whether bariatric surgery itself leads to poor oral health, whether there's a cause and effect link between the operation and what we see in the mouth. I'll cover this more when I talk about the research, but there are many other factors that may play a role here, making it hard to draw firm conclusions. Examples include other diseases that affect the teeth, the gums, or the saliva, certain medications, dental anxiety that creates the threshold for seeking help, your daily oral hygiene routines, and of course, your diet. Bariatric surgery has been around for more than 50 years now, but only recently have we started asking what it might mean for the mouth. And why only now? Partly because we've organized dental services as something quite distinct, off to the side of the wider healthcare system, at least here in Norway. Partly because we've lacked registry data as a basis to look for associations, and it may also matter that bariatric surgery is performed in surgical clinics. Of course, an obvious place for surgery, but where the prevailing mindset is operate when an organ is sick and needs fixing or removal. With obesity, we intentionally create a controlled injury to an otherwise healthy gastrointestinal system. That does not only cause significant weight loss, it also triggers beneficial systemic effects, physiological changes in other organ systems. Both hypertension and type 2 diabetes can disappear entirely, great examples of positive systemic effects. But it doesn't stop there. Systemic effects can also be negative. Both osteoporosis and anemia can occur. We in the bariatric clinic, and hopefully you as a patient, are aware of these possible complications. That's why we emphasize taking vitamin and mineral supplements, and to be safe, we also include checks for these complications in the follow-up over the years after surgery. Systemic effects get more challenging when the links are unclear, especially when the effects show up years after. Tooth decay doesn't happen overnight. And an extra factor is that many people feel shame about poor teeth because society often assumes that both a smile revealing nice teeth and being normal weight are purely matters of personal control. I'm not here to scare anyone away from surgery. Bariatric procedures have many very positive health effects. But to make an informed decision about treatment, it's important to understand the possible negatives as well, and above all, how to prevent them. So that's why I made this set of videos where I'll cover some of the research in this field, our recommendations for oral hygiene and checkups you should attend in dental care, and how to prevent issues like acid erosion, for example. Bariatric surgery affects far more than your weight. It can reduce the risk of other serious diseases and potentially add years to your life. My goal is that you are well prepared, so you can harvest the benefits of surgery without taking on avoidable complications. I know for many, this has been a long journey to deciding on surgery. I also know Some get a bit of tunnel vision as surgery approaches. You want the operation, not necessarily all this information. But this is something that changes your body forever and in many more ways than the fat tissue. And you won't always meet clinicians who are aware of these systemic effects. So it might pay off to become the expert yourself.